What is something about research, and maybe even specific to tinnitus research, that you feel like the general public does not really understand, of either maybe what's required, but also the importance of it? Because I feel like there's so much information. We just had Tinnitus Awareness Week in America, and the American Tinnitus Association is, collecting funds and trying to propel the research of tinnitus, because at the end of the day, everybody wants a global cure, right?
Yeah.
When you think about what it takes to do research, what are some of the things that the public needs to understand about the motivations behind it, and that we all want that, but how do we get there? How do we propel forward with research?
Yeah, I think, I suppose research is expensive. It requires a lot of money. And, I think it's hard to raise the kind of money that's needed from philanthropic sources. And we've probably failed to do that. We've had limited successes. Professor Berthel Languth, Sven Benest, and Dirk de Ritter, they raised some money and started a tinnitus research initiative, which I know you're very aware of, and you've looked at their flowcharts. And I remember when I started in this field and I saw that flowchart that you used today in a clinical meeting, like, it just made perfect sense to me. I said, like, this is what I actually thought that was all that was needed, and then if you triage patients into the most appropriate kind of care, that it would help. Now, turns out it's a bit more complicated than that. We need more effective treatments, but I think that we're going to have to. I think it's going to come from the private sector. It's going to come from device companies like ourselves, pharma companies. That's how I believe that more effective treatments will be developed. I think that what the patient advocacy groups and these other groups can do is going to help raise awareness. Maybe that some of that fundamental research, things like the Tinnitus Research Initiative, they have some fantastic programs to get young researchers in, because I think that's another part of it. We need more kind of young researchers. We need more people in tinnitus, full stop. It's quite a small field, so we need more people in research. We need more providers in clinical care, but I'm a firm believer to do that. We need some what I would call beacons of hope. Some early successes we need to show. And that's why, we're so motivated we're motivated to make Lenire bimodal successful, because we obviously wholly believe in the technology. But if the wider world sees that some people are getting some successes, and that the research field is not just going around in circles, which is like, if you're long enough into this research, you see sometimes it does. You see people going back and questioning, are the outcome measures the right outcome measures? And I've been in this field now for 15 plus years, and I've seen that circle go around a couple of times. I don't think that's helpful. I think we need to just get, just accept what we have, and we say, are things perfect? No, they're not, but we're going to move forward, and we're going to build on it. And
we need progress.
Yeah,
right?
we need progress.
They
progress
say progress,
is success.
not perfection.
Yeah,
right?
exactly.
We need momentum.
Yeah.
But I do think, I agree, awareness is really important, because the device companies or pharma companies, if they're not aware that there's that many people suffering and struggling, and we need to look for solutions, it's not going to happen.